On the morning of March 15, 2008, 43-year-old Maria Castellanos kissed her husband goodbye, told him she'd be home by dinner, and walked into St. Augustine Regional Medical Center in Portsmouth, New Hampshire for what was supposed to be a routine gallbladder removal. She never walked out. Maria died on the operating table that afternoon, and her death was ruled an unfortunate complication of anesthesia. Her family grieved. The hospital sent flowers. And Dr. Kenneth Hartwell, the attending surgeon who had operated on Maria that day, went home, poured himself a glass of expensive scotch, and slept soundly through the night. Because Kenneth Hartwell knew something that no one else did. He knew exactly why Maria Castellanos had died. He knew because he had killed her. What I'm about to tell you is one of the most disturbing cases of medical murder in American history. It's a story that spans 11 years, crosses 3 states, and involves a man who took an oath to do no harm and instead turned operating rooms into killing floors. It's a story about a system so broken, so willing to protect its own, that 15 people died before anyone bothered to connect the dots. And perhaps most chilling of all, it's a story about how close Kenneth Hartwell came to getting away with it forever. Let me take you back to where it all began. Kenneth Richard Hartwell was born on September 3, 1962, in the affluent suburb of Wellesley, Massachusetts. His father, Richard Hartwell Sr., was a renowned orthopedic surgeon at Massachusetts General Hospital, and his mother, Eleanor, came from old Boston money that dated back to the textile mills of the 1800s. From the moment Kenneth drew his first breath, his path was predetermined. He would become a doctor. There was never any question, never any discussion, never any consideration of what Kenneth himself might have wanted. The Hartwell men were surgeons, and Kenneth would carry that legacy forward whether he liked it or not. By all accounts, Kenneth was a quiet child. His elementary school teachers at the prestigious Fessenden School described him as intelligent but distant, a boy who preferred to observe rather than participate. He had few friends and showed little interest in the rough-and-tumble games that occupied his classmates. What he did show interest in from a remarkably young age was anatomy. His mother would later tell investigators that Kenneth dissected his first animal at age 9, a squirrel he'd found dead in the backyard. She thought it showed scientific curiosity. Looking back now, we might call it something else entirely. Kenneth excelled academically, graduating from Phillips Academy Andover in 1980 before attending Harvard University, where he majored in biology with a minor in chemistry. His professors remembered him as technically brilliant but socially awkward, a student who could recite every bone in the human body but couldn't maintain eye contact during a conversation. He graduated magna cum laude in 1984 and immediately enrolled at Johns Hopkins School of Medicine, one of the most prestigious medical programs in the country. It was there, in the cold fluorescent hallways of Johns Hopkins Hospital, that Kenneth Hartwell first discovered the intoxicating power of holding human life in his hands. He completed his surgical residency in 1992 and accepted his first position at Memorial Presbyterian Hospital in Richmond, Virginia. The year was 1993. Kenneth Hartwell was 30 years old, freshly credentialed, and eager to prove himself. The hospital administration was thrilled to have a Hopkins-trained surgeon join their staff. They had no way of knowing they had just invited a predator into their midst. The first death that would later be attributed to Hartwell occurred on November 12, 1994. The patient was 67-year-old Walter Jennings, a retired postal worker from Chesterfield County who had come in for a hernia repair. The surgery itself went smoothly, but Walter never woke up from anesthesia. The cause of death was listed as cardiac arrest secondary to anesthetic complications. His wife, Dorothy, was devastated but never questioned the hospital's explanation. These things happen sometimes, the doctors told her. Surgery always carried risks. Walter was laid to rest in Hollywood Cemetery 3 days later, and Kenneth Hartwell attended the funeral. He stood in the back, watching Dorothy Jennings weep over her husband's casket, and no one thought anything of it. Surgeons often paid their respects to patients who died under their care. It was considered professional, compassionate even. But here's what no one knew at the time. Kenneth Hartwell had injected Walter Jennings with a massive overdose of potassium chloride approximately 6 minutes before the surgery concluded. Potassium chloride, for those who don't know, is the same drug used in lethal injections. In small doses, it's a common medication used to treat potassium deficiencies. In large doses, it stops the heart almost instantaneously. And the most terrifying part? Once the heart stops, potassium chloride becomes virtually undetectable in the bloodstream because potassium is a naturally occurring substance in the human body. Levels spike dramatically after death anyway, making it the perfect poison for someone who understood human physiology the way Kenneth Hartwell did. Walter Jennings wasn't a random victim. He was a test. Kenneth later admitted in his eventual confession that he had selected Walter specifically because of his age and pre-existing heart condition. If anyone looked too closely, there were plenty of natural explanations for why an elderly man with a history of cardiac problems might die during surgery. It was low risk, high reward, and Kenneth wanted to see if he could do it. He wanted to see if he could take a life and walk away clean. And when he did exactly that, when the medical examiner signed off on the death certificate without so much as ordering an autopsy, something fundamental shifted inside Kenneth Hartwell's mind. The thrill he felt wasn't guilt or fear or remorse. It was power. Pure, absolute, intoxicating power. For the next 3 years, Kenneth Hartwell operated at Memorial Presbyterian without incident. He performed hundreds of successful surgeries, earned excellent reviews from patients and colleagues, and built a reputation as a skilled if somewhat cold surgeon. But beneath that professional veneer, Kenneth was planning. He was watching. He was selecting. The second victim came in February of 1997. Her name was Patricia Okonkwo, a 54-year-old schoolteacher from Richmond who had come in for a thyroidectomy to remove a benign growth. Patricia was healthy, active, and had no significant medical history that would suggest any surgical complications. She died 19 minutes into the procedure. Again, cardiac arrest was listed as the cause of death. Again, no autopsy was performed. And again, Kenneth Hartwell walked away without a single person suspecting a thing. Now, you might be wondering how this was possible. How could a surgeon kill 2 patients in the same hospital with the same apparent cause of death and not attract any suspicion? The answer lies in something called the wall of silence, an unwritten code that exists in hospitals across America and around the world. Doctors protect doctors. Nurses protect doctors. Administrators protect the institution. When something goes wrong, the instinct isn't to investigate but to explain, to rationalize, to move on. And Kenneth Hartwell understood this better than anyone. He knew that as long as he spaced out his kills, as long as he selected vulnerable patients whose deaths could be easily explained, he could operate with virtual impunity. But Kenneth made one critical mistake in those early years, a mistake that would eventually help investigators piece together his decade-long killing spree. He kept records. Hidden in a locked drawer in his home office, Kenneth Hartwell maintained a leather-bound journal in which he documented every single kill in meticulous detail. The date, the patient's name, the method, and most disturbingly, his emotional reaction to each death. Why would a serial killer keep such incriminating evidence? Hubris, perhaps, or maybe something darker, a need to relive the murders, to savor them long after the victims had been buried and forgotten. In the spring of 1998, Kenneth Hartwell left Memorial Presbyterian and accepted a position at St. Augustine Regional Medical Center in Portsmouth, New Hampshire. The official reason for his departure was a generous salary increase. The unofficial reason, which would only come to light years later, was that a young surgical nurse named Rebecca Torres had begun to notice something strange. She had been present during Patricia Okonkwo's surgery, and something about the way Dr. Hartwell had behaved in those final moments before Patricia's heart stopped had never sat right with her. She couldn't prove anything, couldn't even articulate exactly what had seemed wrong, but she had started asking questions. And Kenneth Hartwell had learned that the safest predator was one who knew when to move on. St. Augustine Regional Medical Center was larger than Memorial Presbyterian, with over 400 beds and a surgical department that performed more than 8,000 procedures annually. It was the perfect hunting ground for a man like Kenneth Hartwell, a place where he could disappear into the crowd, where individual deaths wouldn't stand out against the statistical background noise of a busy hospital. He arrived in June of 1998, and within 3 months, he had claimed his third victim. But what Kenneth Hartwell didn't know was that Rebecca Torres had reached out to a colleague at St. Augustine, a woman named Dr. Evelyn Shaw. And Dr. Shaw had promised to keep an eye on the new surgeon from Virginia, the one with the impeccable credentials and the ice-cold eyes. The question was, would she see what was hiding in plain sight before it was too late? #the surgeon who secretly poisoned 15 patients over a decade while hospital staff looked the other way. #Part 2. The pattern emerges. For 7 years, Dr.